Welcome to the Rojas Report, where we break down the business of healthcare and expose systems working against patients, physicians, employers, and investors. This show exists because the industry is rigged to benefit the middlemen, while those who are actually delivering the care get squeezed. Each episode, we're going to bring you expert insights, unfiltered analysis, and interviews with people shaping the future of healthcare delivery. We cover how PBMs are screwing you. Indiana University, IU Health, is running a monopoly under the guise of a nonprofit. And the VA, they just burned $55 billion outsourcing their job to UnitedHealthcare. And for the big one today, why are copays, deductibles, coinsurances, and pre-authorizations the biggest ripoff of all time? This is the kind of reporting you will not get from the industry's paid mouthpieces. I'm Dutch Rojas. Let's get into it. Have you ever wondered why your prescription prices keep going up? I don't wonder, but I'm going to help you not wonder either. Even when the actual drug costs haven't changed, it's very simple. You don't live in a free market or a capitalistic market. You're in a rigged game run by four massive PBMs: CVS Caremark, Express Scripts, OptumRx, and Prime Therapeutics. These four companies control 90% of the prescription drug business in the United States, and here's what they do. Number one, they set completely fake prices. The list price of a drug is not real. PBMs jack up the price so they can negotiate a discount and pretend they've saved you money. Take insulin, for example. You hear all the time about how big pharma is to blame for high insulin prices. But here's what's actually happening. The actual cost of a vial of insulin is less than $10. But the list price, $300, $400, $500. Why? Because PBMs force manufacturers to inflate prices so they can take a bigger cut. And the worst part, patients end up rationing insulin. People have literally died because they couldn't afford their prescriptions. But PBMs, they just keep raking in the bucks. Number two, they own everything. CVS, for example, owns the PBM, the insurer, and the pharmacy. They negotiate prices with themselves. Here's a real-world example. The independent pharmacy in your neighborhood, you know, the one that's been there for 30 years, run by local pharmacists, the PBMs are shutting them down. They manipulate the reimbursement rates so that the independents lose money on every prescription they fill. Meanwhile, they funnel all the business to their own corporate chains like CVS and Walgreens. Seems rational. Number three, they profit off confusion. Rebates, spread pricing, hidden fees. You'll never really know what the actual drug costs because they don't want you to. Employers are getting crushed. PBMs tell companies they're getting discounts, but in reality, everybody knows we're overpaying for prescriptions by 20, 30, maybe 50%. I don't know. Bottom line, PBMs aren't lowering any prices. They're inflating them to increase their cut. Up next, we're going to talk about another scam: state-funded healthcare monopolies. The good Hoosiers of Indiana are in the top 10 most expensive places for healthcare. That sucks for you. That is what monopoly's all about, though. IU Health, that's Indiana University Health, is legally a not-for-profit. But in practice, it's a monopoly. How do I know? They pull in $8 or $9 billion a year and use their tax-exempt status and state power to crush the competition. That's how. First, the United States government, via the Centers for Medicare and Medicaid, pay IU Health 2 or 3 times what they pay independents for the same procedures and services. Here's an example. Colonoscopy. It only happens 19 million times a year. The facility fee is only $1,000 difference. A hysterectomy only happens 600,000 times a year, and there's a $1,200 difference. And finally, MRIs only happen 40 million times a year, and there's only a $1,400 difference. And all of that difference is before anesthesiology gets paid and the treating physician gets involved. Second, they use all of their excess cash to expand. Instead of reinvesting in patient care, they buy up independent practices, start insurance companies, which they sell for lots of money, and build new facilities. Here's another real-world example. A group of independent orthopedic surgeons in Indiana was offering knee replacements for about 50% less than IU Health in their own facilities. What happened? IU Health bought out their practice for a ridiculous amount of money, consolidated the orthopedic department, raised prices, and for you, that means raising premiums double digits. Third, they lock in employers and patients. Once they buy out independent facilities, they force employers into exclusive contracts. IU Health has so much market control that Indiana employers have no choice but to use their system, even when the prices are way higher. And the executives, it's got to be nice, they're raking in millions while claiming to be a not-for-profit. My psychiatrist says I'm probably jealous. I mean, who doesn't want to go to fancy conferences with the family every month on a PJ? If IU Health wants to compete, why don't they have to play by the same rules as everyone else? Lobby dollars. Until then, they're just a corporate empire disguised as a charity. Coming up next, the grift that continues. Here's how bureaucrats at the VA wasted $55 billion outsourcing their core function to UnitedHealthcare. But first, quick break. Hey, the VA is supposed to take care of veterans. Why? Because they're veterans, but also because they sign arduous 100-page draconian contracts to give up their lives, become the property of the United States government in exchange for lifelong health care benefits. And what did the executives at the VA do? Slobs. They want jobs at UnitedHealthcare, so they outsource claims processing and network management to the UnitedHealthcare. Instead of the VA obtaining agreements for medical services and actually paying physicians and facilities directly, they're paying UnitedHealthcare to manage payments and build the network. Obviously, the results are terrible. Payments are delayed, right? Because why not take the float? Physicians and facilities are screwed. UnitedHealthcare is infamous for denying claims, underpaying physicians, hospitals, and clinics. By the way, the inefficiency, as you know, is not a mistake. It's the entire point. The more complex the system, the more money UnitedHealthcare makes. Here's a real-world case. In 2022, dozens of physicians went public about how UnitedHealthcare delays with VA payments were causing weeks, even months of unpaid claims to pile up. Meanwhile, veterans are waiting longer for care. Physicians want to help veterans, but can't wait months and months, and they're getting tired of paperwork, so they stop seeing veterans altogether. Who wins? Not my veterans, but UnitedHealthcare. I built a national network for less than $7 million. The VA, they've had $55 billion, and they still can't build their own networks or pay their own bills. That's not just a waste. It's a design grift propped up by lobbyists and lawmakers. VA, you made a promise to veterans. Veterans, I suggest you call your congressman. Next up, why do health plans have copays, deductibles, and coinsurances? It's a bloody disaster. All right, I'm back. Now this segment's got me fired up. There are no good reasons for deductibles, copays, coinsurance, or pre-authorizations. You hear me? If you're an employer with more than 150 employees and your health plan still has pre-authorizations, deductibles, copays, or any out-of-pocket fees, you're either complicit in making it harder for your employees or you're completely stupid. There, I said it. You heard me. I know some of you don't like it, and frankly, I'm 10 years past caring. All your fake niceness and no spankings BS has led us here. It's time for spankings to return. Someone find me a paddle. Micah, I need the help. There are plenty of options, by the way. I built one of the first in 2008, and today there are more than 200 companies that remove out-of-pocket barriers and simultaneously make your annual plan spend significantly less. I mean, help me out here. Why are trillion-dollar companies like Apple, Google, Tesla, Meta, I mean, you name them, still outsourcing their employee health care to Blue Cross or some turd company called Cigna or UnitedHealthcare? You mean to tell me that companies that invented making hundreds of billions of dollars, that design microchips, build AI, send rockets into space and bring it back, can't build their own networks, pay their own invoices, and design a health plan better than Blue Cross, United, Cigna, or Aetna? They negotiate semiconductor deals, send rockets into space, save astronauts, connect billions globally on a daily basis, build world-class hardware and software, and I'm supposed to believe that negotiating with a bunch of healthcare facilities run by a bunch of mids is too complicated? Because here are the facts, and they are undisputed. You like that movie reference? Self-insured employers could build their own networks for pennies on the dollar. They could eliminate pre-auths, deductibles, copays, and out-of-pocket expenses entirely, and they'd actually pay 10% of what they're paying these insurance carriers to screw them and their employees. But instead, they choose to keep signing the same bad deals. with the same bloated carriers, pretending like they have no other choice. And the employees just go along, get along. If you're running a company, ask yourself, is it time for a deep dive into healthcare coverages? Are you actually taking care of your employees? Or are you just letting an insurance carrier nickel and dime you to death? Because if your answer is, well, Dutch, we've always done it this way, then congratulations. You're part of the friggin' problem. Healthcare isn't broken, it's rigged. And employers have the power to unrig it. Stop signing bad deals. Build your own networks. Remove the encumbrances. Pay your own bills. And finally, stop with the stupid excuses. And thank you for joining me on the first episode of the Rojas Report. Remember, if you have any questions, email us at info@ficap.com. Follow me on X and LinkedIn to stay updated on the latest healthcare business and how we're cutting out the middlemen. If you like the show, share it. If you hated it, I don't care. Share it anyway. Stay sharp, stay informed, and don't let the middlemen win. See you next time. Rojas out.